begin tonight with kids being poisoned by THC after getting into their parents' gummies. It's a trend one local emergency room physician is speaking out about tonight. Good evening, everyone. Welcome to News 2 at 6. I'm Bob Mueller, and News 2's Alex Dennis joins us now in studio with more on this warning. Alex?
Well, Bob, I was contacted by a Nashville hospital wanting to share the news. There has been a concerning rise in kids locally sickened by THC, requiring emergency room care. Physicians are now urging parents to take common sense steps and store drugs out of the reach of children.
I'm concerned.
Dr. Marla Levine, a pediatric emergency medicine physician at Monroe Carroll Jr. Children's Hospital at Vanderbilt, is alerting parents to the dangerous trend involving kids and the drug THC.
2 years ago, we may have seen a one-off case of an accidental ingestion, and now we're seeing this much more frequently.
She explains this is particularly a problem in children ages 5 and younger who mistake the colorful candies for harmless gummies.
So when they're marketed to adults, the intention is to have a little bite here, a little bite there, to get a little bit of a high, and that's it. When children get into these medications, they're consuming the whole thing, and that results in a toxic dose.
These children show up at the emergency room poisoned from the high dosage of THC, causing a variety of complications.
These children come in with complete alteration in their level of consciousness. Additionally, these children will come in with profuse vomiting. Some will come in with seizures.
In the most extreme cases, these young patients must be admitted to the pediatric intensive care unit.
There have been several cases of children who've had such a profound depression in their breathing drive that we as providers have to intubate those children.
It's a problem parents need to take seriously, but the good news is
this is avoidable.
Store all drugs out of reach of children, and don't be afraid to ask others to do the same.
In the same way that you want to make sure that alcohol is not sitting out in a home where your child is going to play with their friend, I think it's perfectly appropriate to inquire as to whether or not there are edibles in the home and to ensure that they're safely stored out of reach for children.
So if your child needs immediate attention, of course, you want to call 911. If you have more questions, call the Tennessee Poison Center number, the number here on your screen. That hotline is available 24 hours a day, 7 days a week, year-round. Bob.